Greetings. My name is Dr. Christopher Baker, and I've been invited to provide a brief introduction to neuropsychology and how you might take some steps toward pursuing a degree in this area. To give you a little bit of background, I completed my undergraduate degree at Northern Michigan University, attended the University of Cincinnati for my PhD, then completed my internship at Patton State Hospital, and finished with a 2-year postdoctoral residency at the Cleveland VA and Cleveland Clinic. And that's a pretty typical course of events in terms of pursuing a degree in neuropsychology. I'm currently a staff neuropsychologist at Pine Rest, which is a large behavioral healthcare provider in Michigan. I hope this brief introduction is helpful in providing you some insight into the discipline of neuropsychology, how it might appeal to some of you, and how to help guide some of the decisions that you make going forward. Neuropsychology is a really fascinating field, and I could talk for hours about it, but given that our time is limited, I'll try to keep to the nuts and bolts of the discipline. At its most basic, neuropsychology is the study of brain-behavior relationships. Its primary focus is how various conditions affecting the central nervous system in turn impact several different aspects of human behavior, most notably higher level cognition, as well as mood and psychological functioning. Neuropsychology is probably best conceptualized as a blending of clinical psychology, neurology, and psychiatry. There's a great deal of overlap between these disciplines. The training requirements for becoming a neuropsychologist have been clearly laid out through what are known as the Houston Conference Guidelines. It's a consensus that was reached by many neuropsychologists at a conference in Houston in 1997. The goals were to establish guidelines for consistent training that would ultimately result in board certification. And this is kind of the norm for those that pursue a degree in neuropsychology, is to pursue board certification as kind of the final step. The basics are that an individual needs to obtain a 4-year bachelor's degree from an accredited university, followed by completion of a doctoral program in clinical psychology with a focus in neuropsychology. This can be achieved through either a Doctor of Psychology, also known as a PsyD, or the more traditional Doctor of Philosophy, or PhD. There are advantages and drawbacks to both, although generally speaking, the PhD provides individuals with greater latitude in terms of their professional and career choices, because it allows you to go into things such as clinical practice, but also teaching and research. I'm sure that the discussion of PhD versus PsyD is something that you will have covered at some point in some of your classes, so I won't address that here. But if you want to discuss what degree is the right one for you, should you decide to pursue that path, feel free to reach out to me, and I'm happy to discuss that at greater length. There is no such thing as a doctorate in neuropsychology per se. The degree is always in clinical psychology, but with a designated emphasis and specialized focus in neuropsychology. And so this is a distinction from other tracks in psychology, such as psychological assessment, experimental psychology, quantitative methods, health psychology, etc. So it's important to find a graduate program that offers specialty training in neuropsychology. Once one decides to pursue neuropsychology, most tend to choose an additional area of specialty in either pediatrics or adults. There are programs and individuals who train in what is often referred to now as lifespan neuropsychology, which involves individuals of all ages. But most tend to specialize primarily because the assessment tools and methods, along with the academic training, vary considerably for pediatric versus adult populations. Once you complete your doctorate, you will then need to complete a 1-year APA-approved internship in psychology with a designated track in neuropsychology. Following this, you will need to complete a 2-year postdoctoral residency in clinical neuropsychology. Neuropsychology is unique in that it is the only discipline in all of psychology that does require a 2-year postdoctoral residency in order to obtain board certification. Whereas the other disciplines typically require only a 1-year residency, or in some cases, no postdoctoral residency at all. So when all is said and done, you can expect approximately 8 to 10 years after your undergraduate degree to complete all of your training. That can sound overwhelming when you think about it, but it's definitely worth the time and the energy. One of the important things to understand about neuropsychology is that it demands an understanding and knowledge base of several different disciplines, notably psychology, statistics and research methodology, neurology, psychiatry, behaviorism, and psychopharmacology. And this is what makes neuropsychology a very rich and diverse practice. So, what does a clinical neuropsychologist do anyway? As a clinical neuropsychologist, the primary question I am typically being asked to address is 1. What is the status of the patient's cognitive and intellectual functioning? This involves a thorough assessment of intelligence as well as several other areas of higher cognitive functioning, such as attention, working memory, visual and nonverbal memory, processing speed, language, and executive functions. Second, the next question is, once we understand the nature of an individual's cognitive deficits, what is the underlying etiology or the cause of those deficits? And most importantly, how do they impact their day-to-day functioning? When determining the cause of an individual's symptoms and deficits, there is a bit of an art when it comes to interpreting the results of an assessment within the context of the patient's clinical history. Generally speaking, the degree and pattern of an individual's cognitive deficits is very often correlated with various clinical syndromes. So, for example, the results from a neuropsychological evaluation could help differentiate between someone with an early dementia of the Alzheimer's type, a vascular dementia, or a frontotemporal dementia, all of which typically have very distinct neurocognitive profiles. It could show a pattern that is consistent with, for example, Parkinson's disease, or perhaps multiple sclerosis, or a number of other various medical conditions. It could also point towards a more focal, localized syndrome, such as those seen with brain tumors, seizures, or known strokes. In my practice, about 90% of my referrals come from a primary care physician or neurologist. Oftentimes, they send me a patient who is reporting some concern to them about cognitive deficits. They are then referred for an evaluation, which involves a thorough clinical interview, lengthy battery of tests that assess areas such as the ones I described before. And then nearly every evaluation involves a lengthy questionnaire to assess psychological and personality function, such as the MMPI, PAI, or MCMI, which are some of the more commonly used instruments. A typical neuropsych evaluation could last anywhere from 3 to 8 hours, and there is almost always a feedback session with the patient and usually some of their family to discuss the results and provide recommendations. At this point, it might be helpful to talk about what you guys could do to prepare for a career in neuropsychology. At the undergraduate level, in addition to the classes that are standard to a psychology major, it's important to complete coursework in classes such as physiological psychology, anatomy and physiology, research and methodology, and statistics. This will provide you a good foundation for when you go on to graduate school. I would encourage you to volunteer in any type of research lab that's available, although the specific area of focus is probably not as critical as simply getting some type of exposure to research. There are a few professional memberships available to join at the undergraduate level, although you might want to check out websites at the National Academy of Neuropsychology or the American Academy of Neuropsychology. These groups hold conferences annually and are a good resource to get more information on the field of neuropsychology. When it comes to applying to graduate programs, it is important to emphasize that in order to become a neuropsychologist, you must first become a good clinical psychologist. So all of the programs that you will be applying to should be in clinical psychology programs with a designated track in neuropsychology. I would also encourage you to consider the population you would like to work with, such as child versus adult, to see if programs have specific tracks with those populations. One of the greatest pieces of advice I could probably offer when applying to graduate programs is to recognize that in most cases, you are really applying to a particular research lab or faculty member within the clinical psychology program. So, while you may be applying to, say, the University of Cincinnati's clinical psychology program or Kent State University's clinical psychology program, you are more specifically going to direct your application to a specific faculty member with particular research interests. It is often these individuals who accept students into their lab, and approaching your application process this way can help improve your odds of acceptance and also help you to narrow your research and clinical interests. So, for example, I applied to work in a research lab that explored the effects of epilepsy on neuropsychological functioning, and we worked closely with an epilepsy monitoring unit at a regional hospital where patients with refractory seizure disorders were evaluated to determine their candidacy for surgery to eliminate their seizures. So I think approaching your application process in this way can help you to really narrow your focus, figure out what appeals most to you, while also maximizing your likelihood of acceptance. Broadly speaking, neuropsychology has several unique applications. Personally speaking, I also practice as a forensic neuropsychologist, which is an area that many neuropsychologists do on occasion. This involves applying neuropsychological assessment and knowledge to help make decisions in the legal arena. This includes both criminal and civil litigation. So, for example, a patient that sustains a head injury in a motor vehicle accident and is involved in some type of lawsuit or seeking disability, they may seek an independent forensic neuropsych evaluation to help determine whether he or she has any deficits and whether those deficits might be related to the injury that they sustained. Other civil work involves assessment of things such as testamentary capacity, determining whether someone needs a legal guardian, and fitness for duty evaluations, to name just a few. Neuropsychology lends itself to forensic criminal evaluations by helping, for example, to determine competency to stand trial for an individual with intellectual disability. It may also help to determine whether a medical condition or brain injury may have implications in a plea of not guilty by reason of insanity. So, in addition to the clinical work that neuropsychologists are involved in, there are several other areas of application. Some work almost exclusively in research. As with any area of professional practice, there is a great deal of overlap between clinical work and being informed by the current research. So it's important to not only possess good clinical skills, but also be able to understand and stay up to date with current research so that it can inform a constantly evolving clinical practice. To end, I'd like to add that one of the most rewarding aspects of working in the field of neuropsychology is the richness of diversity in terms of who and what you encounter. I also enjoy the personal aspect of working closely with patients and their families. One of the things that I always try to remind myself of is that for a lot of patients, the reason they are coming to see someone like myself is because they have some very real challenges in front of them, and they're often apprehensive, anxious, and concerned about what the results may show. This provides an opportunity to really connect with patients on a more personal level and hopefully leave them and their families with some optimism and hope and a greater understanding about how they can manage the challenges that are in front of them. I hope that this brief summary has been helpful in providing some insight into neuropsychology and how it might appeal to some of you. I wish all of you the very best going forward in whatever path you choose, and good luck.